Thank you so much. It is my privilege again to introduce Dr. Sue Bailey. And just a reminder, I'm Patrice Burgess, our delegate from Idaho to the AMA. I really wish I was introducing Dr. Bailey in person. Was excited to have her out to Idaho and show her Sun Valley. So hopefully we can make that happen at another time. But nevertheless, Dr. Bailey is our immediate past president of the American Medical Association and a distinguished allergist and immunologist from Fort Worth, Texas. She's been a fierce advocate for physician autonomy and private practice. She's held numerous leadership positions within the AMA, including serving as Speaker and Vice Speaker of the House of Delegates. She chaired the Advisory Panel on Women in Medicine. She chaired the AMA Council on Medical Education, and she served as the 175th president, just recently ending that term. She's also represented the AMA on the Accreditation Council for Continuing Medical Education and the American Board of Medical Specialties and COLA. She's served in organized medicine at all kinds of levels, the local level, the state level. She's been board chair and president of the Tarrant County Medical Society and vice speaker, speaker, and president of the Texas Medical Association. Dr. Bailey's been an allergist in private practice for over 30 years and completed her residency in general pediatrics and then a fellowship in allergy immunology at the Mayo Graduate School of Medicine in Minnesota, and has been awarded the title of Distinguished Fellow of the American College of Allergy, Asthma, and Immunology. And in addition to receiving her medical degree with honors from Texas A&M University College of Medicine, she was later appointed to the Texas A&M System Board of Regents by then Governor George W. Bush, and has been named a distinguished alumnus of Texas A&M University and of Texas A&M University College of Medicine. So always look forward to Dr. Bailey's comments, and I'm sure she has lots of wisdom from the AMA, but also lots of knowledge about COVID vaccines and all things COVID. So maybe we can pick her brain about that too. Dr. Bailey.
Oh, thank you so much, Dr. Burgess, for that kind introduction. I agree. I wish we were doing this in person. I was really looking forward to coming to Sun Valley and to be with you. But, you know, the Delta variant obviously had other plans. So I'm glad we were able to do this virtually, but you still owe me one. So I'm going to get there by hook or by crook. I was looking at my remarks to this wonderful group from last year, and I was struck by how far we've come in just a year. My remarks last year, we talked a little bit about vaccine confidence, but the trials were still ongoing, and we were in such a different place. But in many ways, we're still in the same place we were then. And I know Idaho has been hit especially hard in the fourth wave of this pandemic. And so I applaud the leadership of the Idaho Medical Association for being an ally to physicians across the state. I am going to bring up my slides here. There we go. Hopefully everybody can see that. For being a voice for science and credible information in a time of great misinformation and falsehoods about the virus, the variants, the vaccines that are now widely available. This is an effort that the AMA, as well as Idaho Medical Association, every medical association in this country and across the world has been fighting this fight. And it's been a really difficult challenge over the last 19 months, but I remain confident that we can still turn the tide against COVID-19. And the more people who have yet to do so will become vaccinated. This is still our best defense against this deadly virus and our surest path to end the pandemic. So let me first thank outgoing President Dr. Joe Williams for his steady leadership at this very difficult time in our history. And congratulations to your new president, Dr. Stephen Coates, for stepping up to confront the challenges that await. This is a very difficult time, but it's also a very exciting time to be in medicine. And we can be proud that this pandemic has shown the very best of our physician community and the entire healthcare workforce. This was in Times Square in the spring of 2020, when New York City was at the peak of its first wave. And the AMA was happy to post this along with NASDAQ to thank physicians for their work. And I thank you, not only in Idaho, but across the country. Physicians have risen to the challenge of this incredible moment. But physicians, nurses, and all healthcare and support workers continue to work long hours at great personal risk to themselves and their loved ones. Our nation owes them our gratitude, whether they have been caring for COVID patients on the front lines of our hospitals or simply trying to keep their small private practices and weather the economic storm of the pandemic. Now, an unanticipated silver lining. I hate to say there are any kind of silver linings to this horrible last year and a half, but this time has shown us the tremendous value of organized medicine nationally, at the state, local, and at the specialty levels. Put simply, when we join together in the thousands or tens of thousands as an association, we are able to do far more than we could alone or in a small group. Working together, organized medicine has delivered the support, the resources, and the expert guidance our colleagues need at this most challenging time. Since the beginning of the pandemic, the AMA's response has been fourfold. First, by providing trusted, evidence-based resources and clear guidance to physicians on the front lines of the pandemic. Secondly, by helping physicians and practices recover from the disruption and the damage of the pandemic. Thirdly, advocating for patients and physicians with the government to reduce obstacles to patient care, and advocating for science-based, equitable policies on pandemic control strategies, testing, and vaccine development and distribution. I know IMA has been working on many of these same issues locally and supporting our physician colleagues here at home. This work is so important, and I thank you. Since the beginning of this pandemic, AMA has been focused on supporting physicians on the front lines by pushing Congress and the administration for PPE and other resources to help keep physicians and healthcare personnel safe. The AMA has also helped support physicians in private practice recover from the economic storm of COVID-19. We worked with Congress to secure billions in emergency funding to help physician practices stay viable and able to provide much needed care. We worked on broad telehealth expansion and improved payments at the federal and state levels to increase access to care and provide patients with a safer way to receive care. We have created dozens of new CPT codes for COVID-19 testing and other measures related to the pandemic. And we've encouraged private insurers to waive prior authorization requirements. And we've created dozens of free online tools and resources to help physicians take care of their mental health and troubleshoot common pain points they encounter in their practices. These include resources for managing mental health, caring for the caregiver, telehealth implementation, just a general guide to the pandemic, CPT coding guidance, of course, coronavirus updates from the JAMA network, and an incredible variety of other resources, tools, and support. Now, one of our most important roles during the crisis has been standing on the side of science and medicine in an atmosphere of misinformation, disinformation, and the politicization of the medical crisis. As physicians, we've often found ourselves fighting a war on two fronts, caring for severely ill patients in a raging pandemic, while at the same time battling a public relations war that questioned the legitimacy of our work and our motives. And now we're fighting misinformation about the safety and efficacy of vaccines, the only thing that will lead us out of the pandemic. We must continue our stand for science and speak out against misinformation through and beyond the pandemic. And it's especially troubling when this misinformation comes from within our physician ranks. AMA has policy on policing physicians who spread misinformation, and we support state medical boards who do the same. The AMA policy reads in part, intentionally providing misleading information to patients and the public is inconsistent with AMA's Code of Medical Ethics. But policing COVID-19 misinformation in a time of fear and uncertainty is far too great a challenge for any one entity to take on alone. And this task becomes even more significant in the face of multiple sophisticated disinformation campaigns that have invaded search engines, retail websites, and even mainstream media. The AMA has been working collaboratively to combat misinformation, to debunk myths, and convey evidence-based information about COVID-19 vaccines and treatments from credible sources to create a common understanding of facts. That's really the only way to empower people to make informed decisions about their health. Now, at our meeting of our AMA House of Delegates almost a year ago, we addressed vaccine confidence issues head on. No, the meeting was virtual, of course, as will this next one. Our House of Delegates adopted new policy to combat misinformation through an aggressive public education campaign. Physicians are key players in this campaign. Research suggests that trusted voices can demystify the process of vaccine development and distribution. The best messengers for vaccine information are influencers within their own communities, often us, their personal physicians. I think often we don't give ourselves enough credit, or we just underestimate the power that we have to influence our patients' decisions. And a strong recommendation from a healthcare professional is a key factor in encouraging vaccination. In short, if we trust it, our patients will trust it. And I know that you heard, like I heard early on when vaccines became available, well, doctor, have you taken the vaccine yet? Have you gotten vaccinated? And I was always glad to say that I got one as soon as I possibly could, and encourage them to do the same. Now, since the beginning of this pandemic, and even now in its ongoing stages, the AMA stands resolute in our support of science and evidence, and we continue our call that elected officials and those running for office affirm science, evidence, and facts in their word and actions. We call on the media to be vigilant in communicating factual information from credible sources and to challenge those that trade in misinformation. We call on social media platforms to advance evidence-based information from credible sources and to reduce the spread of misinformation. We call on health institutions to base decisions on scientific evidence, data, and equity. And we call on governments, scientific institutions to be led by experts in the field. I had a wonderful time representing the AMA this past year, working with the Ad Council. They're the folks that were responsible for Smokey the Bear, Only You Can Prevent Forest Fires, and other really wonderful and sticky ad campaigns. And so the AMA worked with a number of other leading organizations to educate the American public and build confidence around COVID-19 vaccines. We're proud to be a founding partner of this vaccine education initiative and the It's Up to You campaign. Now, of course, the pandemic has consumed a great deal of our focus over the past 19 months, but we haven't lost sight of our many other priorities. When it comes to advocacy, here again, we see the power of organized medicine. If a legislative or regulatory change is needed to improve the practice environment, a single physician has a really tough time going it alone. But membership in organized medicine allows thousands of physicians to speak with a united voice before policymakers at the local, state, and federal level. Now, let's look at prior authorization requirements for one. This is a perfect example of the type of paperwork burden that interferes with patient care and costs physicians time in their day. we are working hard to try to, as we call it, right size prior authorization. We're not naive enough to think that we can quickly eliminate it. Result from the AMA's December 2020 survey highlights the significant negative impact of prior authorization on patients and physicians. Nearly a third of physicians report the prior authorization process required by health insurers for certain drugs, tests, and treatment led to a serious adverse event. Nearly a third of physicians report a serious adverse event like death, hospitalization, disability, or other life-threatening events for patients in their care. On the average, practices complete about 40 prior authorizations per physician per week, which consume an average of nearly 2 business days of physician and staff time. I know back in the day when I would return back to my office from a meeting or even a vacation, there would be a stack of charts waiting me on my desk that I needed to go through and answer questions. Now, it's a stack of prior authorization requests. So for several years, the AMA has conducted a multifaceted campaign urging health plans to right-size prior authorization. In 2018, we joined the American Hospital Association, America's Health Insurance Plans, the American Pharmacists Association, the Blue Cross Blue Shield Association, and the Medical Group Management Association. And we developed a consensus statement that outlined a shared commitment to industry-wide improvements to prior authorization processes and patient-centered care. The AMA is advocating for passage of a specific bill in Congress, HR 3173, the Improving Seniors Timely Access to Care Act, HR 3173. It's a bipartisan bill recently reintroduced into the House, and it starts with requiring Medicare Advantage plans to implement many of the concepts that were addressed in the consensus statement. Unfortunately, this consensus statement has pretty much fallen on deaf ears and not even been adhered to by some of the groups that were a part of its development. But we continue to work at the state level to push for prior authorization and step therapy reforms in legislatures across the United States. I know we just did some in Texas, and I'm anxious to see how these will work. Several states have broad reform legislation currently pending, and the AMA is working very closely with medical societies to provide legislative language, talking points, data, other resources that they might need. We're asking all physicians to get involved in our grassroots advocacy campaign. Hashtag FixPriorAuth is where you can find it on Twitter, or fixpriorauth.org for the microsite. The AMA supports physician-led teams and is committed to defending physicians from scope of practice incursions. The AMA's scope of practice partnership includes partnerships with over 100 national, state, and specialty medical associations. This group has awarded more than $2 million in grants to its members to fund statewide and local advocacy tools and campaigns. Since 2019, the AMA has helped with more than 100 state legislative victories, stopping inappropriate scope expansions of non-physicians, including bills that would have expanded the scope of practice of nurse practitioners in more than 14 states. No, we have not won every battle, but we also have not ceased to fight these incursions. This year, 2021, we've seen nurse practitioners, physicians assistants, pharmacists, CRNAs, and optometrists all seeking to expand their scope. So in preparation for this onslaught, the AMA doubled its contribution to the scope of practice partnership. And this has already made a big difference in our ability to help more than 30 state medical associations with on-the-ground resources needed to defeat these bills. Most recently, we joined 102 other physician organizations in objecting to the Department of Veterans Affairs Supremacy Project. What a name, which involves developing national standards of practice for 48 categories of health professionals that would override long established state laws governing scope of practice and health professional licensure. We believe the VA has way overstepped its bounds and failed to consider that these health professionals don't operate in isolation, but rather as a team. Yet the VA is creating and moving standards forward independent of one another. To provide the best care for our vets, the VA must engage in a systematic examination of how all these standards will fit together and affect the health professional team. Well, of course, we can't get together without talking about payment issues. The AMA successfully worked behind the scenes in pressing the House and the Senate to reach an agreement to eliminate Medicare sequester cuts that were set to begin last April. The new law extends the existing 2% Medicare sequester moratorium through the end of this calendar year. Now, this was a great win for physicians who were really worried about another crippling financial blow without extending this moratorium, piled on the financial challenges that we've all suffered during the pandemic. And to put it bluntly, it would not have been possible without the power of medical organizations working together. But as I know you're aware, our work is not finished. Physician practices are confronting an even greater threat of Medicare cuts, totaling almost 10% on January 1st of 2022. Now, these cuts reflect the combination of a return of the 2% sequester cuts and the expiration of the 3.75% in Medicare physician payment relief, which we successfully lobbied Congress for in last year's Omnibus Appropriations Act. Now, this was to mitigate the impact of cuts due to the revised E&M coding and payment policies. And then a new 4% sequester, which will be imposed to partially offset the costs of a COVID relief package enacted earlier this year. The AMA takes the threat of cuts very seriously. We know the financial hardships that physicians have experienced during the pandemic. We've been working with federation groups and friends in Congress to get these issues addressed. We've urged Congress to act, but there's really nothing currently in the reconciliation bill that's working its way through Congress. We continue to press on these issues and have activated our grassroots. There will be a major push to get relief included in the end of year package. We're also strongly pressing the Biden administration and Congress to address the underlying long-term challenges associated with just the overall Medicare physician payment system. Well, moving on from payment, adult use of cannabis isn't an issue that I'm often asked to talk about, but as more states move to legalize its use, it's certainly a question now that is coming up more often. Recreational use of cannabis is now legal in 18 states. Medical cannabis with a prescription is legal in 36 states. Any type of use is illegal in 11 states, including Idaho and my own state of Texas. And 3 states have decriminalized, which basically means you can pay a fine, but you're not going to get thrown in jail. So the bottom line with cannabis is, despite a major shift in public attitudes about its use over the past 30 years, there remains significant and important questions about its safety and efficacy. The National Academies of Science, Engineering, and Medicine maintains that the medicinal benefits of cannabis are still largely unknown, but that its prolonged use is associated with lower birth weight, an increased number of motor vehicle accidents, and other risks. The U.S. Surgeon General has also issued warnings about the health risks tied to cannabis use. The AMA does not support legalization of cannabis for adult use until additional scientific research has been completed to fully document the public health, the medical, and the economic consequences of its use. And we remain particularly concerned about cannabis use by young people, as well as by pregnant or breastfeeding women, and continue to call for robust public health messaging on the negative health effects of cannabis. In states that have already legalized cannabis, we believe jurisdictions should take steps to regulate the product effectively to protect public health and safety. This includes regulating retail sales, limiting the potency of cannabis extracts and concentrates, and requiring that the packaging for edible products is child resistant to protect children from unintentional ingestion. We also encourage jurisdictions to allocate a substantial portion of their cannabis tax revenue for public health purposes, such as substance use disorder prevention and treatment programs and cannabis-related educational programs. Medicine's pandemic response has led to a paradigm shift toward telehealth, a trend that will continue to grow. In 2016, only 14% of physicians were doing virtual visits. In 2019, prior to the pandemic, that number had doubled to 28%, but of course that has exploded since the beginning of the pandemic. My personal practice went from 0 to 100% telemedicine in what seems like a few hours last spring. Another study showed that more than 90% of physicians, including caregivers on the front lines, were using this modality to treat patients remotely. And nearly half of those physicians were using telehealth technology for the first time. Surveys show that the majority of patients and physicians want virtual care to continue even after the pandemic is over. 68% of clinician respondents are motivated to increase telehealth. 75% of clinicians indicated that telehealth enabled them to provide quality care. This is from a COVID-19 Coalition Telehealth Impact Survey. A J.D. Power survey showed that patient satisfaction scores for telehealth is 860 over 1,000, which is the highest score for all healthcare insurance and financial services. Now, the AMA has strongly supported this shift towards telemedicine and has advocated its use as a lifeline for patients and physicians. One of the most significant barriers to wider adoption of telemedicine previously were restrictions on where patients had to be located to receive these services under Medicare rules. And as you're aware, private insurance also often follow their lead. And so we worked with CMS to temporarily remove these restrictions so Medicare patients don't have to be in a federally qualified health center or a very remote rural area to receive telemedicine services. And we support making these changes permanent. We're working with Congress and policymakers at HHS to make it easier for physicians to provide remote care. The AMA has developed a number of resources for physicians that are implementing telehealth in their practices or maybe to improve the services they already offer. Just like many of us didn't stick with our very first electronic medical record vendor, the same has been true with telehealth platforms. You may not stick with the one that you started with. And the AMA Digital Health Implementation Playbook Series offers comprehensive step-by-step guides to implementing digital health solutions in practice based on insights from across the medical community. This and much more information can be found on our website, ama-assn.org. So in closing, thank you again for this invitation to join you and for all that you have done in the last 19 months to support the physicians and patients here in Idaho. It's a consequential time in healthcare, and we're fortunate to be able to do the work we do. I'd be happy now to take questions if time remains. And Dr. Burgess, I'm going to turn it back over to you.
Thank you so much, Dr. Bailey. We really appreciate, as always, your updates, and we always learn so much. And we do have a little time for questions. I'm going to turn it back over to our CEO, Susie Keller, to moderate the questions.
Thank you, Dr. Burgess. Thank you so much, Dr. Bailey. Delegates, if you have any questions for Dr. Bailey, please post them to me in the chat. And I'll start off with the first question I received. Dr. Bailey, can you tell us about your thoughts about the COVID booster being administered here in the United States, since the World Health Organization has asked for a moratorium on boosters until other countries have adequate access to the vaccine? Could you comment on that, please?
Yes, our AMA House of Delegates has not opined formally on boosters, but we do have a representative, Dr. Sandra Freihofer, who's also on our Board of Trustees, who represents us on the CDC's Advisory Committee on Immunization Practices. And her understanding of the data and my understanding of the data is that it can give a tremendous boost to antibody levels and further reduce the rate of disease, hospitalization, and death. We are missing data, though, about natural immunity. We know that offers some protection. We really, though, don't know if you were to make a pie graph of of the United States and people's COVID status and how well protected they are against the Delta variant. How much does the first 1 or 2 injections confer? How much extra does the booster confer? How much does natural immunity confer, and how long does it last? And what is herd immunity even really a concept that we can talk about anymore? Because we know we still have to press so hard, and there will always be a number of folks who are unable or perhaps unwilling to take the vaccine. I took the booster myself last week. Unfortunately, or fortunately, I guess I'm in that age group where it's kind of uniformly recommended. And so right now we are operating along the recommendations that the CDC has made for boosters in elderly Americans, and for healthcare workers, but this is not formal AMA policy yet.
Got it. Thank you so much. There's actually a couple of other questions, but unfortunately we are out of time and have to move on. So we may follow up with you with some of those questions and get back to our folks.
Please do.
Oh, thank you so much. You've been so generous with your time, and yes, we will get you to Sun Valley and another beautiful spot in Idaho as soon as we can. So we just are very grateful for your leadership and your continued advocacy for physicians and for science. So thank you so much for joining us today.
Thank you, and have a great rest of your meeting.